Burping. I'm going to talk about burping today. For those of you who are new here, I'm Gail Macklin, registered nurse and international board certified lactation consultant. I've owned a lactation center for the past 18 years, and I would say of all the questions that I get asked, burping is definitely in the top 3. People always want to know, 1, how to burp their baby. 2, a lot of people will think that breastfed babies don't burp as often as bottle-fed babies. And 3, they want to know what positions they should use. They just saw something on YouTube. And I will say that probably I've been a lactation consultant for 30 years. So I would say I've probably seen every position of burping that you could possibly do. And honestly, there's still new ones that come in. Okay. The traditional burping methods are probably the ones you see here. So this is a mom burping her baby with her baby laying down on her lap, which is a great position to do it. This one is probably one of the more popular ones where you sit your baby up and you pat them on their back. That's really popular. And then you also, sometimes people will kind of take them in a circle one way and take them in a circle the other way. And I'll show you that in a second. Then this one is your traditional kind of, I have my little baby here, an over the shoulder burping method. And this one is probably the one that people just naturally do the most. You just got done feeding your baby, you pop them over your shoulder. Some people will do it a little bit more down here. Some people will put them over their shoulder, and sometimes this is nice because a little bit of pressure on their tummy, even if you get them a little higher, also helps them to burp a little bit easier. So that can be a good method too. And this is another method. It's kind of the same similar method as you're kind of holding them upright and letting them lean. You know, you're sitting them like this. You're letting them lean on your hand, so you're not choking them. You're just kind of letting them, especially a newborn, like a little bit older, you can hold them here, which can put a little pressure on their tummy, and then do it like that. With a newborn, a lot of times they're so, not a lot of tone to their body, so you may want to just hold their cheeks like this and pat them here, or some people will pat them a little further down. Sometimes I'll even, when I'm holding a baby, sometimes I'll even like pat them on their little tushy, and that seems to help bring up a burp too. Interestingly, in the past, I've had a couple patients who have been pediatric gastroenterologists, and I'm always super interested to see how they're going to burp their babies. And honestly, the 3 or 4 pediatric gastros that I've had in my office, I will be watching closely to see what they're going to do, not saying anything myself. And all of them have not even burped their babies, which I also found interesting. Because the fact is that even if you don't burp your baby right after, they're probably going to just burp on their own, just like we do. If we eat something and we have a burp, it just kind of pops out. Or sometimes people come in and they're burping their baby for a really long time, like 5 minutes or 10 minutes, like they're trying to get a burp out. And I usually, when I'm burping a baby, I just do it for a minute, maybe a minute, a couple minutes if I'm just talking to somebody or whatever. And if they don't burp in that amount of time, then I just don't burp them. Now, some of you are going to say, but I have a baby who spits up a lot. Well, 2 things about that. 1, sometimes I see people burping their babies like this. And they say that's the only way they can get a burp out. And I'm not saying that's wrong, because there's no really right or wrong way to burp a baby. But if you're doing it too hard and your baby's a spitty baby, a lot of times it causes them to really projectilely spit up, and a lot can come out. And it seems like they lost their whole feeding, although they probably didn't. Some people will also kind of take their hand and give a little pressure and see if they can kind of, not too hard, but just kind of see if they can help some of that air come out. And then there's, of course, the ones where you kind of sit them up like this and you rotate them a little bit this way and then a little bit this way. And then I have people who come in and they'll just say, I sit my baby up just like this after they're done eating. I just wait a minute and the burp just comes out. So that's a little bit about burping. And formula fed or bottle fed, if you're giving your breast milk in a bottle or if you're using formula in a bottle, do they need to burp more often? I don't think necessarily. I mean, I see breastfed and bottle fed babies. To me, it seems like they burp kind of equally. But of course, I work more with, babies that are breastfeeding, but certainly there's a lot of moms that are breastfeeding and bottle feeding. You go back to work and you're still, you're bottle feeding or somebody's bottle feeding your baby. So I also think you have to watch your baby, and that goes for everything. So when you are working with any baby, if they seem uncomfortable, burp them, and maybe burp them a little more. If they're really, have a lot of tummy troubles, it can be really helpful to baby wear them in a carrier so they're upright after a feeding. And if you have a really spitty baby, even if you hold them for like 15 or 20 minutes up after a feeding, a lot of times they still spit up the minute you move them. So spitty babies are often going to be spitty babies no matter what you do, and it just takes time for them to outgrow that. Usually they have a little bit of a loose, what we call a lower esophageal sphincter, and so sometimes it just takes time for that to tighten up. So that's a little bit about burping. And if you have questions or want to discuss it, go to the chat, 2 a.m. chat, and hear what other moms are doing.